Hello and welcome to the third episode of the podcast series Healthy Dose. As you all know, the global rollout of vaccines against COVID 19 is in full steam. Yes, there have been some hiccups along the way, and there will continue to be. But largely speaking, there are reasons why one could think of the global rollout of vaccines as a beacon of hope regarding the humanity's capacity to come together to face a collective challenge. Vaccines have definitely been the ray of hope at the end of the dark tunnel, but can they possibly also be a vehicle of change? I'm Yogini, your host for this episode, where we talk to Dr. Arindam Nandi on financing of vaccine programs and how vaccines benefit us more than we know. Dr. Nandi is a fellow at the Center for Disease Dynamics, Economics and Policy and has extensively studied vaccination programs in India. We will talk to him about innovative financing mechanisms that have been used in the COVID-19 pandemic, their past precedents, and how they will translate into the future. Without any further delay, let us just get into it.
My name is Dr. Arindam Nandi. I'm a senior fellow at the Center for Disease Dynamics, Economics and Policy, based in Washington, D.C. In terms of background, I'm a health economist doing primarily research on economic evaluation of health interventions in low and middle income countries. And a bulk of my work is actually in India. I have done research on several health interventions and policies and what kind of impact they might have on the health of the population and economic outcomes as well, starting from child vaccination, neonatal care, water and sanitation, and so on. I do quite a bit of research on the economics of vaccines. I've done work in India on vaccine financing, how the Indian government does financing mechanisms for childhood vaccines, as well as the broader benefits of vaccines. What are the benefits beyond prevention of disease and prevention of deaths?
That is very interesting, Dr. Nandi. At least for me, my earlier memories of, say, getting vaccinated or going through immunization program have to do with polio. But till the time we were recording this podcast, I had never thought about how this whole machinery rolls. How do so many children get this drop every year? And now I suppose also a follow-up dose. So I was just wanting to start our discussion there, that how do immunization programs such as polio or other mass immunization programs work in terms of their economics and in terms of their financing? Who finances them? What is the money behind it?
Okay, so India's national program, known as the Universal Immunization Program, it is one of the largest programs in the world, and one of the fascinating ones. So every year, about 26 million newborn children are born in India, and the target is to vaccinate them with a series of different types of vaccines, so that by the time they reach the age of 2 years, they are vaccinated against most diseases, starting from say measles, BCG, diphtheria, pertussis, tetanus, which is DPT, and now we have even a lot of new vaccines. Hepatitis B, rotavirus, the pneumococcal vaccine is being introduced and rolled up, the Japanese encephalitis vaccine. So it's a gigantic program, which is run across all of India, and we have seen, alongside the main program, which has been running since the 1980s, starting in 1985, alongside the main program, which tries to vaccinate children with all of these doses, there are supplementary programs. And polio is a really great example. Pulse polio was a supplementary immunization program, which is on top of the main program. Because polio is such a debilitating disease and can have such a lasting impact throughout the life on children, special attention was paid to polio, and a separate polio program has been running really successfully.
There is a lot to unpack here, so I'm just going to highlight what Dr. Nandi spoke about. Mentioning universal immunization program as the backbone of immunization in India, he mentioned that it is an ever-growing large program with constant addition of newer vaccines against newer diseases. Additionally, there are supplemental programs for diseases such as polio. Let us listen to Dr. Nandi speak about the financing models behind these programs.
Now, obviously, in terms of financing, there are two separate models. One is for the UIP, the Universal Immunization Program, which is the main program that gets funding of about 12,000 crores every year. And the government has been doing it quite systematically in partnership with organizations such as the UNICEF, where every 5 years a white paper called the CMOIP, which is known as the Comprehensive Multi-Year Plan, is formulated, which will project the amount of money that will be needed over the next 5 years every year. Now, in terms of who provides that money, India is very heavily self-sufficient. So during the last CMIP, which was 2013 to 2015, those numbers are available to us. The Indian government paid about 93% of this, 12,000 crore or so amount of money that is needed to vaccinate her children. The rest of the 7% was provided by multilateral donor agencies, such as, the Gavi is one big funding support for India for the remaining amount. So that 7% in 2013 to 2015 was funded by Gavi. Now, Gavi support is being phased out, and in 2022 budget, the estimated expenditure for the program is 12,000 crores, 12,364 crores to be exact. And of that, India will fund 97% of the amount, and other partners, the UNICEF, Gavi, the World Health Organization, together will fund about 339 crores.
It's very interesting that you mentioned Gavi. Actually, that's what our next question was going to be about, because Gavi has come into a global limelight of sorts, for people who don't generally know so much about vaccinations. So, what is Gavi? Like, what is the concept behind Gavi?
So Gavi is a multilateral agency which is supported by national governments around the world. So think of, going back in time, if you could think of World Bank as an entity, it was started with the idea that countries will pull their money together, and then from that money there could be grants given to deserving countries, low income and low and middle income countries. Sometimes there could be loans that could be given to some of these countries. So it's a similar model but it's obviously much more improved than the World Bank model of just putting money together and then lending out or giving grants to countries. Gavi is an organization which does that funding mechanism, as well as it's an organization which has done a lot of research into vaccine development, vaccine financing mechanisms for countries, and vaccine distribution mechanism for countries as well. So Gavi has been supporting low and middle income countries. They call them Gavi eligible countries, which are provided with technical support for vaccine rollout and also funding mechanisms, sometimes just money given as grants in support of their national vaccination program, as well as for introduction and rollout of particular vaccines. And then also, it's a consortium which can make deals with vaccine manufacturers, and it sort of acts as a clearinghouse where a national government can come to Gavi, and Gavi can help facilitate a deal with a vaccine manufacturer at a subsidized price, which is much lower than what the manufacturer would charge in the private market. because such high volumes of vaccines are being bought at on one go, Gavi can facilitate that kind of deals as well.
Gavi has also been crucial in global rollout of COVID vaccination. How has that facility worked? Because it's worked with Kovacs and it's worked with WHO. So, how does the economics of that function?
So, the idea of the of trying to come out of a global pandemic is that every country has to vaccinate its entire population, or up until sort of a herd immunity is reached. To come out of this global pandemic and to leave all of this behind us, we have to vaccinate as many people as we can across the globe. And that's the sort of the founding principle of the Gavi. Many countries have made bilateral deals with manufacturers. For US, for example, has already made deals for millions, 200, 300 millions of doses of the Pfizer vaccines or the Moderna vaccine to vaccinate the population within the US. Other high-income countries have done something similar with manufacturers as well. But to make sure that we can vaccinate equitably across the globe, so that all of us can come out of this pandemic and have good health again and have economic growth again, Gavi created this consortium called Kovacs, which is it's a partnership of national governments, scientists, policy experts, the private sector, multilateral policy agencies such as the WHO, and donor agencies as well, such as the Gates Foundation. All hands are on the deck.
Dr. Nandi explained to us how different stakeholders have marched together to find Kovacs. Essentially, Kovacs is a facility where stakeholders have pooled in money that has helped them towards the creation of an effective vaccine. Now, the question to ask is, how do these countries claim their stakes? Can only those players who have paid receive vaccines through the facility?
And the idea is to create three types of financing mechanism for vaccines, for the COVID vaccine. One is, so there are three types of country participation. One is, some countries, they are giving firm commitment that we can fully fund our vaccine purchase, and we commit that we will buy XYZ number of doses. So that is number one, which is self-funded firm commitment from countries. Second is self-funded purchase option. So Kovacs started primarily with the Oxford AstraZeneca vaccine, which is being manufactured heavily by the Serum Institute of India. But there are other vaccines which are coming in the market as well. So some countries they have this option of saying, it's like in the share market, it's an option that you're purchasing, just like the share market. You're saying, I want the option of buying 100 million doses over such and such time period. But it is not a firm commitment. So I have the option to back out with a small penalty. So the amount of money that I'm going to give you, the per dose price that I'm going to get from the COVAX facility, that has a small amount of money built into it, which is to cover the manufacturer in cases where you want to take a step back and say, no, I don't want 100 million doses, but I want a smaller number of doses. So that risk insurance is built into the price for these type of countries who are purchasing the option for getting. And then finally, the COVAX AMC. The AMC is a mechanism where they're trying to provide it at the vaccines at a highly subsidized price for low and middle income countries. So these are the sort of the original Gavi eligible countries who are expected that they wouldn't be able to fully self-fund their entire purchase. So the idea is to either try and give them these doses for free, depending upon how much fundraising the AMC facility can do, and if not, and Gavi has maintained, in general that these AMC countries will actually have to pay a small amount and share the cost up to 1.6 to $2 per dose, which would be lower than fully self-funded countries and countries who are purchasing the option of buying from the Kovacs. So these are the three different mechanisms, to ensure that there's equitable distribution of vaccines across the globe. And then the idea is that all countries, right at the beginning, should be able to vaccinate at least 20% of their population across the board, across all countries, before additional doses are given to countries who have booked more doses. But at least right at the beginning, all countries should be able to vaccinate 20% of their citizens using the vaccine doses that are coming from the COVAX facility.
Dr. Nandi just explained to us how funding mechanisms under Gavi Kovacs have been designed to vaccinate 20% of population horizontally throughout the world. To break the global chain of infection, it is necessary that all of us have the weapons to fight it. Only then can we be successful in our fight against COVID-19. While the pandemic disrupted our way of life and broke economies, it also brought with it scientific advances in a speed considered impossible before, and innovative economic and financial mechanisms. Has this happened in the past? And what are its impacts for the future? We will explore this in the next few questions. I believe that this coming together of hands on the deck of so many participants has happened. Has this happened at some other time in history? Not in the same exact form, perhaps, but is this the first time that such a global rollout has happened, or could you cite some examples from the past?
So not at this scale, obviously. This is unprecedented. That all countries of the world will need so many doses. We're trying to vaccinate maybe 7 billion of this planet's people at some point, eventually, because right now the vaccines are not authorized for use among children, so you don't have the pediatric population getting the vaccine right at this time. But this is really unprecedented. But this builds upon the history and experience that Gavi has had, because Gavi has been working for a long time, and people, as you mentioned, that we don't normally hear about Gavi as such, because we don't really pay so much attention to all these other vaccines that are being given to children. Polio draws a lot of attention because it's a separate program, which is heavily advertised. Amitabh Bachchan comes on TV and so on. Gavi has been working with national governments and other agencies over a long time.
Do you think something like this could also, because this has happened at scale, could this be helpful in, say, fighting diseases that we haven't found a vaccination for yet? Perhaps this is a hypothetical question, but just wanted to know your views on that.
Yeah, certainly. I mean, there are. I don't believe that it could get as big as this, because this really happened because of the pandemic. But there are other agencies. There are always research groups and multilateral agency groups who, for example, to give you a good example, one emerging area that we will have in the next 20 to 30 years is, for example, Alzheimer's and other related dementias. Because once you take care of problems such as cardiovascular diseases and eventually maybe HIV and cancer, if we find cures for those, then eventually the main challenge, the challenge 20, 30 years down the line would be, people would be aging a lot. And in low and middle income countries, life expectancy is going to only go up, and you will have, more people living into their 70s and 80s than ever before, right? So that's an emerging challenge where people have started thinking about it in high income countries where there are research groups and industry and interagency groups who are talking about investing a lot into the research for Alzheimer's and related dementias, because that's one area where the progress or scientific breakthrough has been really slow. There is only one, I believe, Alzheimer's drug which came really close to being approved. I don't remember exactly whether it finally got approved or not during the last decade or so. So then, there's a whole lot of talk about. There was a consortium. There was a meeting in Davos a few weeks ago, which was called the Davos Alzheimer's Collaborative, where all these interagency groups came. A lot of people who work in the industry are trying to develop medicines for Alzheimer's and so on. They're trying to form this partnership, looking 30 years into the future, when we get to the point where even in low and middle income countries, people are living into their 70s and 80s, then Alzheimer's will become a huge problem. And they're trying to solve it, starting from now. So there are other examples. Alzheimer's is one example. I'm sure there are examples. I know about Alzheimer's. That's why it's easy for me to talk about it. But I'm sure for other diseases, there are consortiums or groups who are thinking at a very large scale, how to get together the private sector, the policy sector, the national governments, and so on.
You've been a scholar working in early childhood interventions, and I was wondering that, like, generally we've read about immunization programs being affected by COVID. So, how great do you think is the loss, if there is any, in terms of a loss, stopping of immunization programs, and uh, what could be its long-term impacts?
Yes, certainly. That's actually quite important. So there have been two types of impact. One is the cost of delivering vaccines have gone up. So that's one. It is harder and more expensive to vaccinate children with the other vaccines, just because COVID has affected everything in terms of supply chain, health facilities being overloaded with COVID patients, and lockdowns, local lockdowns, national lockdowns, and so on. And then also another side is obviously fewer children are being vaccinated. The vaccination rates have seen a dip, and nobody knows how long the dip will remain, and what is extent of that dip. We're still waiting for data on some of these indicators. And obviously, that is going to have a long-term impact. For example, if you take the case of the measles vaccine, measles is a disease which is just doesn't affect children by itself, but it can also have a longer-term impact on suppressing the immune system. So there have been some recent studies which have shown that once you have an episode of measles, as a child, you are going to be more susceptible to other infections for up to 2 to 3 years following that episode of measles, because it just wreaks havoc on your innate immune memory, and it makes you vulnerable to other infections. So if measles vaccination rates go down, then you're looking at a cohort of children who are going to have, other additional diseases within the next 2 3 years. And some of these diseases can have long-term impact over their life cycle in terms of, reduced cognition, reduced schooling outcomes, schooling grade attainment, and reduced academic productivity. So we don't know the full extent of those long-term effects yet, but I'm hoping, within the next few years, once we have those estimates of, how many children's missed vaccinations because of the pandemic, then we'll be able to do those estimates.
The coronavirus pandemic has forced us to think about the world as an interconnected whole. Global vaccination may have paved the way for global cooperation against Alzheimer's. Such occurrences further bring these interconnections in a sharper relief. This leads us to our last question. What could the long-term impacts of global vaccination rollout against the pandemic be? So you studied the impact of vaccine on impact of early childhood vaccinations or impact of influenza vaccines on AMR, I suppose, antimicrobial resistance. So in that sense, if and I know this is like far into the future, uh, these studies must not have happened yet, but what do you think could be the long term impacts of uh, having a vaccine against a global pandemic? At least what will you seek to study in the future if you have to make any long term analysis of the impact of the vaccine?
Yeah, that's a great question. So, I'm not an epidemiologist, I'm an economist, but from my limited knowledge, what I've read, that there is a possibility that this might become a seasonal vaccine because, if there are new variants of COVID, let's think about 2, 3 years down the line when, enough of the global population has been vaccinated against the main or the first variant of COVID. If there are other variants of COVID which pop up here and there, this could be sort of like the annual influenza vaccine, which is given in many countries, which will be like a booster shot. For the new variant, if it comes, you might have an annual vaccine against the COVID strain, which is relevant for that year. So if that's the case, then this can have a really potentially long-term impact on several different aspects of life. As you were mentioning, we have done some work on influenza vaccines and their potential impact on antimicrobial resistance, how influenza type illnesses are treated heavily with antibiotics in many countries, where you go and you say that, I have a fever and a cough. Turns out it's a viral infection from an influenza strain, but sometimes doctors will prescribe you with an antibiotic. Or you can go to a pharmacy in countries like India, where it's not heavily regulated as in other high-income countries or other countries, where you might be able to get an antibiotic dose from a pharmacy. So that contributes to antimicrobial resistance among pathogens, right? A lot of people who experience COVID have long-term symptoms of shortness of breath or coughing and so on, body ache and so on. So having a COVID vaccine can have really potentially a life-changing impact if you are susceptible to long COVID, especially for those people. So that's one. And then also, if this becomes sort of like an annual influenza type of infection, it might have an impact, sort of like a secondary impact on children, where if children, they get sick and they miss school days, that might have some impact on their cognitive outcomes and schooling outcomes. So it could reduce the number of schooling days lost or schooling days missed if the children are vaccinated. In the near future, say within the next 2, 3 years or so. So these are some potential impacts we might see from COVID vaccination. And in the absence of the vaccination, other mitigation strategies involve lockdown as a primary strategy, social distancing, reduced capacity in businesses, all of which will have far-reaching long-term impacts on economic growth. So if we can prevent that, say the ideal scenario 2, 3 years down the line is you don't need to do social distancing as much. You don't need to do capacity control in businesses. You can have restaurants open. You can have schools open. No more lockdowns and so on. That would be fantastic, right?
With that note of hope, discussing the long term impact of the COVID-19 vaccination and what it means for our future, we come to the end of this episode. We spoke to Dr. Nandi about a great many things, about the potential of vaccine and the potential that innovations from these very dark times carry into the future. As they say, every cloud has a silver lining. The pandemic has caused us to deeply reflect on the epochal impact that scientific and economic advances have on our lives. Vaccines, it seems, can be true vehicles of light and hope. In the context of a global pandemic, how is India distributing this vehicle of light and hope to millions of its people? Thank you for tuning in to the third episode. In the next episode, my co-host Shrivastava will be speaking to Dr. R.S. Sharma about how India is leveraging technology to deliver vaccines to its millions. Do tune in. You can find us on SoundCloud and Spotify as Vidhi Center for Legal Policies podcast. We are also available on iTunes and Google Podcasts. Don't forget to grab your healthy dose next Tuesday.